In a structural kinesiology class, I just know when it comes to the shoulder girdle that you need to take away with you that the muscles that cock the throwing shoulder, the throwing side, are the same muscles that deaccelerate the arm. So in the phases of acceleration and deacceleration, the external rotators are of the humerus and the cockers of the scapula, the retractors of the scapula. So please internalize this. This helps you understand throwing. That's going to be way good for you. I'm quite sure that you get the imperative that there be freedom at the sternoclavicular joint, the acromioclavicular joint, in order to have full movement at the glenohumeral joint. You know that there's an intimate relationship between the scapula and the thorax. It's not a true joint, but it needs to be tucked up and secured in its position on the thorax. So would you accept the premise that if there's a lack of range of motion here or here, that person's not going to have full range of motion at the glenohumeral joint? Similarly, if you accept the notion or the concept that in order for the humerus to have full movement, the scapular motors must get the glenoid fossa in the ideal position for the acromion. Stabilizing influences of all of these joints are recorded for you. The ligaments get their names by the bones that they attach. If they're attenuated, if they're stretched out, usually that happens from a violent loading, then they can be ruptured, and you need to be aware of that if you're working with athletes that are colliding, landing on the ground. And then movements of the scapula, elevation and depression, protraction, and retraction, and then upward tilting. That's associated with abduction, and frankly, there's tilting that goes on. Upward and downward tilting, that would be where if my ribs were this way, the tilt would be in the sagittal plane, anterior tilt, posterior tilt. And then it's just way good to know the scapular motors. For all of these movements, the muscle motors that contract concentrically and then control the movement in the opposite direction eccentrically. So there's just no substitute for getting this internalized and knowing how we position the scapula appropriately. And then I'm very, very intrigued by the serratus anterior. I really enjoy this depiction. This would be anterior. Sternum is here, vertebrae are here. Here's the anterior surface of the scapula. These are the ribs, and the sartorius attaches along the anterior vertebral border. And when this contracts, it protracts. So it's a push-up muscle. Anytime you're doing pushing, you're protracting the scapula. That's just quite a remarkable design. So here are the proximal attachments. The distal attachment showed here. Maybe I should say anterior and posterior attachments. But you can see there's fingerlets to 9 ribs. And if the rib attachment is the dock, the boat is the scapula. So the concentric contraction pulls that boat into the dock. And then retraction, the rhomboids and the middle traps on protraction. On your if you'll go to E-class and call up the PowerPoint, there's movement that's occurring. These are videos, and you can click on them and see the scapula in movement. And then this is a reiteration with more detail. Appreciate the fact that this is in a transverse section. So if I was dissected right through here, through my humeral head and then into my ribs, here's the scapula, here are the ribs, humeral head and the glenoid fossa, here's anterior chest with pectoralis muscles. This is the subscapularis that fills the subscapular fossa, and this is the serratus anterior. So when this contracts, yeah, the scapula protracts. So we've hit that pretty hard, and we go back into the joint. Appreciate that it's a very shallow glenohumeral glenoid fossa articulation. It's like a golf ball on a tee, really. The precision, the proprioception that goes on to make sure that the muscles provide dynamic stabilization. It's more like a seal. If the seal's nose represents the glenoid fossa, the ball is the humeral head. So it requires dynamic stabilization for that. And then movement at the glenohumeral joint. I think this was a new movement to many of you, scaption. If you consider the position of the scapula in both the lateral, in the frontal and sagittal planes, instead of being just like this, it's like this. And when we raise our arms, I'll come here, when we raise our arms with flexion and abduction, that's said to be in the plane of the scapula. I'll do it this way, in the plane of the scapula. This would be pure abduction, this would be pure flexion, this is scaption. You just need to be aware of it when you're talking to other professionals that are dealing in the shoulder. And then again, I'm going to the well again here, that there's no substitute for knowing the muscles by action, by region, and by action. You just have to internalize these, and I think you've had enough experience with using applications and images that are available to you. Please internalize the muscle motors. And then we break these down by action further in the PowerPoint. I won't go over all of them. I think you are quite familiar with the biceps. The long head is a two-joint muscle. The short head attaches on the coracoid, so it's not a two-joint proposition there. All right, and then the triceps, the long head of the triceps crosses the joint. The other two heads do not. Okay, so this is an extender, the triceps, an extender, and a horizontal extender. And then the deltoid, you know, we've spoken of the deltoid. It's three portions. The anterior portion will internally rotate and horizontally flex. When all three deltoid heads contract, big time abduction concentrically. The pecs, the pec major has two heads. The sternal head fibers run this direction, and the clavicular head run in this direction. So the way to strengthen this is the regular bench press. The way to strengthen this is the incline press. And then also in terms of internal rotation, the subscapularis, you can see its fibers goes to the lesser tubercle, and when this contracts, it internally rotates. And then external rotators, I think you can spend time on that and know them by heart. Posteriorly situated, the infraspinatus and the teres minor, and the posterior deltoid are big external rotators. And then the inert tissues that couple the humerus into the glenoid fossa. Rotator cuff, the sits muscles, and you know that the spinatus, so there's the spine of the scapula, the supraspinatus fossa. Its tendon passes under the cover of the coracoacromial shelf. There it is emerging. All three of the supraspinatus, infraspinatus, and teres minor attach to the greater tubercle of the humerus. The subscapularis attaches to the lesser tubercle. I want to, I think you've got that. So on my anatomy, the subscapularis is, we'd have to dissect off the scapula, but its fibers run this direction and insert on the lesser, so when this contracts, it internally rotates. Supraspinatus, infraspinatus, teres minor externally rotate. All of them cuff and dynamically stabilize the humerus into the glenoid fossa. And then something that I didn't talk with you about before is the scapulohumeral rhythm. You can see that this man is he's really flexed and abducted. So he's gone here and he's flexed and abducted. And you'll notice that the vertebral border on this one is not symmetrical or asynchronous with this one. This one hasn't moved as far. That means that there's some impingement or some limitation to this movement. And this is what I want you to know. For every 2 degrees of abduction, there's 1 degree of upward rotation of the scapula. So the scapulohumeral rhythm is that scapula needs to upwardly rotate 1 degree for every 2 degrees of abduction of the humerus, called a scapulohumeral rhythm. There's several leaves in the PowerPoint that will help you focus on that. And then I come back to throwing. This is a violent act if you're throwing something fast, regardless of what it is. And what do you remember from the first slide? It is that the muscles that get us into a cocking position at the release of the throw are the ones who deaccelerate us. Now you should know the names of those muscles, and you should also know the names of the accelerators. So if we just did it simply, cocking, acceleration, deacceleration. The acceleration muscles are anteriorly situated. The scapular motors, obviously there's protraction that's going to go on that's deep, but the posterior muscles get us into this position and then slow us down after we've released the ball. So be a student of the shoulder. It's been good to you. You've got two good old shoulders, and your clients are going to need you to really be a student of the shoulder. Bless you guys. Bye.